long time, but yeah, I'm back, and I just wanted to talk to you about my third and fourth year of dental school. I know the last time I came, I think I spoke about my first year of dental school or my second. I can't remember. It's been a couple years, but yeah, obviously we all have some time now, unfortunately, with what's going on in the world. So just wanted to use this time wisely and bring some information to people who are applying to dental school or who are already in the dental school and trying to figure out what's going to happen for their third and fourth year. So I'm going to combine the two because third and fourth year are pretty similar, at least for me they were. So I have a couple questions that I wrote down and then I'm just going to answer them. Okay, so first thing I have is what classes did you take in third and fourth year? Okay, so third year is for my schools, pretty much we start clinicals the summer before, the summer in between second and third year. So clinical rotations mean that we get into the school clinic or you start doing rotations offsite. So the summer is just, we're pretty much in clinic from 8 to 5 whenever you finish your patient, and Monday through Friday. And then on Fridays is a half day in clinic, and then the second half of Friday for third years is we have a seminar. So we each our school splits us up in 4 groups. So say I'm in group 3, and we have a managing partner, an MP, who leads the group, and he leads the seminar, or we bring in discussion points for the seminar. So that's what our third year classes consist of. Part of third year too, we did have one class, I believe it was practice management, and that was like 2 hours or 1 hour every 3 weeks or so, and we had like a final exam on that. But other than that, we didn't have any other science classes or anything like that. All of that was finished within first and second year for my school. Third year is also when we get into taking boards for my school. So you either take it at the end of second year or the summer in between second and third year, whenever you feel ready to take it. But my school gives, the earliest my school gives permission to take it is the end of second year. So that's around when the first people took it in my class. I took it within my third year that I took it. What else did I have about that? Yeah, just practice management class. That's pretty much in the seminar. That's what we had third year. Other than that, we were in clinic all day. So that was fun. Oh, fourth year is just straight clinic. We didn't have any classes so far. We have rotations, which I'll talk about later. So you're in clinic, either in a school clinic or offsite at a rotation. And we're there from 8 to 5, Monday through Thursday, and then Fridays we have half day as well. In the beginning of first semester of fourth year, those half days we got to go home afterwards. We had like independent study. And then a little bit into the semester, we started having sessions to prepare for the licensing exam during that Friday half day session off. But other than that, no classes. Right now, obviously, we're not in clinic because of what's going on, unfortunately. So we're still trying to figure that out. This is technically our spring break right now. So our school is trying to figure out what's going to happen after spring break to try to get things done to make sure that we graduate in time. Okay, how many units? So I believe everything together. So that one clinical rotation class encompasses everything within that. So say like fourth year, the only thing that we had like first semester part of our grade was CCCD, which is our the dentistry. The CC, one is community, the D is dentistry. I forget the other C in between. But in that course, that's all we had, and that encompasses everything within it. That's all of our clinic sessions, doing everything right, reporting, all of that. That's what that grade encompasses. Some assignments within that as well, but just like little papers. If you went on rotation, you had to write like a summary of how the rotation was. And so that course itself is like over 20 units, because that's pretty much your whole grade. And then third year, we had that along with practice management. Oh, another class we had third year was BSD, which was behavioral studies. I believe, yeah, we had that first semester. We didn't have that second semester. Okay, so what about rotations? So with rotations, for my school, I know every school does it differently, but for my school, we have 2 7-week rotations, meaning that we rotate outside of our school clinic. Every dental school has a school clinic within it, and then some do rotations outside. My school does 2 7-week rotations. We're actually the first class to do 2 7 weeks. It used to be just 1 7-week, and then the class before us, the 2019 class, it switched for them to 1 7-week and 1 5-week, and then for us, it switched to 2 7-week rotations. So and because there's 70 of us in our class, the rotations are split up. About 20 or so people leave at a time. So the first rotations for my class started within third year. That's when the first group went. The rest of us were still in clinic. So it split up little by then. My first rotation was the summer before fourth year. So I was in summer of third year, in between third and fourth year. So that's a 7-week rotation. So I was pretty much gone the whole summer semester, the whole summer session. And I did my rotation in downtown LA. So that was really good. And in those rotations, you pretty much get full-on clinical experience. So when you're in school clinic, you maybe see 2, at most maybe 4 patients if you can fit it into your schedule. When you're on these rotations, you're working with doctors in their clinic. You have to keep up with their pace. They understand that you're dental students, but at a certain point, you have to start picking up your pace. So my rotation, at least at the downtown one, I was seeing 6, 7 patients a day doing different things like extractions, RCTs, fillings, cleanings, everything ranging in there. So I was working as a general dentist pretty much within that clinic, being supervised by the doctors there. My second 7-week rotation was at a clinic in Palm Springs, and that was actually this semester. I actually just came back from that rotation 3 weeks ago. So that rotation was starting 2 weeks into this fourth semester, or this last semester, and then I finished 3 weeks ago. So that was a 7-week rotation. So that one as well, there was a couple more of us there. So at my downtown LA rotation, it was just me technically, because the place had 2 clinics. So there was 2 of us, but we rotated at the different clinics. So we were never together for my class. And then at this rotation that I was at now, my school kind of, they're part of the ownership of this clinical site. So there was 7 of us from my 4th year class who were rotating at this site. And the same thing, I saw a little less patients at this rotation, but it was the same thing, a lot more patients than I would see at our school clinic, and just picking up the pace, picking up speed. And I felt, by that time I was doing that rotation, I felt really confident when I was working, rather than when I was at the other rotation last summer. It was just still new, fresh. I was just coming out my 3rd year clinic, still seeing maybe 1 patient, 2 patients a day, depending on who shows up. And so from both of those, I learned a lot of different experience. I got to do a lot of extractions, over like 70 at the downtown LA one that I was at last summer. And then I got to do a lot of big fillings and crowns and stuff at this rotation in Palm Springs that I had. So I gained different experiences from both of them. So I'm really glad that we have that experience, because I know some other schools, they only rotate a couple times at some sites. So yeah, I'm really glad that I had that experience, because it allowed me to pick up my speed especially. But it kind of slows down when you get back into school clinic, because you can't schedule that many patients within your block, because you have to get all these start checks and everything, which you do have to do at the other clinical rotations, but it just works quicker, because these dentists, they have to get things done faster. It's not a school clinic, it's just a regular clinic. So yeah, I enjoy those rotations. School clinic. So with school clinic, I kind of explained it in that rotation explanation before, but pretty much in your school clinic, for my school, we work with our little. So I'm a 4th year, so I have a little. When I was a 3rd year, I had a big. So in my 4th year, I have a 3rd year little who's assigned to me. And when I have a patient, if they're not on rotation or doing something, they're assisting me. And if I'm not doing anything, I'm assisting them when they have a patient. So our blocks are scheduled 4th year time, 3rd year time. And then if you want permission to schedule within the 3rd year or 4th year block, you have to ask your RDA or whoever's in charge of your group, so you can schedule that. Also, we schedule 1 to 3 or so patients a day. So we have blocks from 8:30 to 12 and from 1 to 4:30-ish. So that's when you schedule your patients. Usually, most people, especially in 3rd year, you're just scheduling 1 patient in each block. Or at most, some people will schedule 2. depending if it's like a post-op check or something like that. But third year, you're still getting learning speed and picking up everything. So you're usually scheduling one patient during that block, especially because sometimes it's not even your fault. Sometimes you maybe can be faster, but you also have your managing partners who have to check every single step that you do. They'll check your prep, they'll check your restorative, they'll check all the work that you do. So, and mind you, there's only two of them supervising a group of, I think us maybe like 15 or so people, maybe I'm exaggerating, 10, 15 people that they're supervising. So they have to check all those people. So there's a lot of time that we're just sitting waiting in line for like 10, 15 minutes trying to get our checks so that we can move forward. So a lot of times people don't like to schedule multiple things at once because it's not even their fault that they're not finishing, but they have to wait a lot, which is typical. You have to go by protocol, so no faults in that. But yeah, school clinic is good. You get a lot of experience, a lot of supervision, but definitely the rotations is where you will pick up your speed. School clinic is kind of just knowing the logistics of everything, making sure you're doing everything by book, by protocol, learning all of that. But when you go on rotation, at my school at least, that's where a lot of people come back and they're just like ready and picked up the speed. So with boards, I talked about that a little bit before. We take part 1 and part 2 for my class. We're the class of 2020, so we're still taking the NBD part 1, part 2. They're transitioning to an INDB, so if you're not in dental school now or you're in first year dental school, you probably will be taking the integrative one, so that's just one big exam. I don't know what that entails, so I'm not going to go into detail about it, but with part 1 and part 2 boards that I took, like I said, the part 1 I took in my third year. Part 2 I just took this past December. And part 1 is 400 questions. Part 2 is 500 questions in 2 days. They focus on different things. Part 1 is mostly science-based, and then a little bit of dental anatomy. And then part 2 is mostly clinical-based. A little bit of science thrown in here and there, but it's mostly clinical based, radiology, dental anatomy, pathology, all those different subjects. So it's 2 different areas of testing and 2 different areas of studying that you have to do, but they're spread apart. For me, part 2 was much more easy to study for. It wasn't easy because it was 2 days and 500 questions, but it was much more easy for me to study for than part 1 was, because sciences aren't really my thing per se, but of course, you need sciences if you're doing anything in the health field, so I do what I do, but part 1 was a lot more difficult for me to focus and study rather than part 2. So, yeah. So seeing patients for the first time, it's a little bit of nerve-wracking because you're going from simulation clinic and doing things on a typodont, and now you're doing something in the patient's real mouth. And, nothing really prepares you exactly for that because you're doing plastic teeth and now you're doing real teeth. And you're like, oh, I don't want to mess up this person's mouth. I don't want to do all this. But, once you get that first time that you do something, then you'll be all right. I wouldn't say that it's the first time that you go into the mouth and you'll be all right for every other procedure. For me, it was, okay, the first procedure that I did, the first extraction I did, okay, I was like, okay, I eased into it and now I can do some more. But I was definitely nervous for every first procedure that I did, whether it's extraction, filling, crown, all that, because it was just something new each time. All the procedures work differently, so yeah. The most difficult procedure for me to get used to, well, not difficult per se, is just the most nervous I was for doing a procedure was definitely extractions, because there's a lot of, that's something that we just have lectures on. It's not something you can practice on the typodont doing. So really the first time that you're doing and learning how to hold a forceps or elevate is really in the first time that you do an extraction in the patient's mouth. So for me, that was a little nerve-wracking. I definitely got more used to it. Like I said, at my rotation that I did, we did like over 60, 70 extractions, some people up to 100. But with that, yeah, it definitely took a little bit getting used to. For a lot of people, I'm not more conservative when I work and when I do things, but extractions, you cannot be conservative. You have to elevate, you have to pull, you have to tug, you have to do all of that, all the logistics of it. So for me, it took a little bit getting used to, but I enjoy extractions now. So yeah. Some other procedures that I did that I enjoyed is I enjoy doing crowns. I enjoy doing aesthetic work. I haven't been able to do a veneer case yet, but I'm hoping that I'll be able to do that at some point. I also enjoy doing fillings. I enjoy that type of work, like where I get to drill and shape, and I like anterior work if I can possibly do that. Like the front work at my last rotation, I was able to build up someone's central teeth, so they're broken down all the way this way, and I was able to build them up with composite, not veneer, but it was really cool just to see how they had nothing there, and then they were so happy when they got to see it. So I enjoy like work that the patient can see afterwards, after I do it. So that's the type of work that I like to do, dentistry that I like to do. Yeah. Okay, so clinical exams. So for my school, some of the schools are based off of numbers. How many procedures have you done? How many this, how many that? My school is pretty much, we're based off of competency. So how competent are you at doing this procedure? So of course you have to do a certain amount before you can test for competency, but it doesn't have to be like 10, 15, 20 of them. So basically they're called CEs. When you're ready in clinic, you have a clinical exam, a CE, graded by 2 faculty. So they'll grade every single step. They have a rubric. And once you pass that clinical exam, say for like, for instance, extraction or class 2 or class 3, once you pass that clinical exam, then you're good for that procedure. Of course, you'll do more and whatnot, but you're good for that. So pretty much we have 11 clinical exams that we have to take with inside clinic. So that goes from class 2, class 3, extraction, crown, the 2 dentures, which is RPD complete. I can't remember all of them. A couple more. Why can't I remember them? Yeah, but a couple more that we have to do. But pretty much it's 10, 11 that we have to complete in order to graduate. So that's a graduation requirements to complete those CE courses or CE exams. And like I said, it's graded by 2 faculty. Those 2 faculty will grade you. You have to get over, I think it's the 70 or 75%. Usually people, when they take it or when they contest the CE, they're really ready for it. So typically most people pass. It's just sometimes it's difficult for people to find that procedure that they need because, you know, they want the ideal extraction. They don't want to do it on like a 3rd molar or a 2nd molar. They hope for like an anterior or a premolar. So sometimes people wait to take it until they get that procedure that they want to do it, or a class 2 we want to do on a premolar possibly, but it just depends on how comfortable you are with the procedure. So after graduation, what are my plans? So your girl's waiting to see if she's going to graduate or not. No, I'm kidding. We're going to graduate. I finished all my CE before all this stuff happened because I knew I was going on rotation this semester. My 7-week rotation. So when you're at rotations, you can't really do CEs. You have to do it at the school clinic because that's the school faculty grades it. So because I knew I was going on my 7-week rotations, I buckled down and finished all my CEs, my graduation requirements last semester, my fall semester. So during that fall semester, I finished all of them. So I was done with that. So with all of this that's happening, that we're out of clinic right now, at least for me, something I don't have to worry about is that my CEs are done and I don't have to worry about that for graduation requirements. We're just waiting to see what's going to happen with if we're out of clinic for a little time with graduation and requirements and accreditation. What's going to happen with that? But yes, we're going to talk like I'm graduating this semester because by God's grace, all this 4 years of hard work won't come to waste. And everyone else who's been working hard these past 4 years, whatever you're doing, you know, even if we don't have that ceremony, it's really sad, but you know, we're here and we're blessed and thank God for everything that he's done. Yeah, I just found out last week that we're not going to have our ceremony, but they said they'll do something else for us. But yeah, it is sad. I was sad about it, but you know, there's people who are going through much worse. So it is what it is. Anyway, so after graduation, I applied to last semester, I applied to residency. I just wanted to get 1 year more of training. I don't want to specialize. I applied to AEGD and GPR programs. I got into an AEGD program, which is Advanced Education in General Dentistry. So it's just a 1 year program I'm going to be doing, getting more experience and getting more supervision and just learning more and building on my skills. And it's something that I feel like that's not going to hurt me. It's just going to help me. So I'm blessed to get into a program that I like, and hopefully I'll be starting that the end of June, beginning of July, if all works well as it should be. So yeah, I'm happy about that. And yeah, if you guys want me to make a video talking about my experience applying to residency and applying to programs, then let me know. I'll do that. And if there's anything more detailed, specific that you want, because I know this was a broad breakdown of everything, let me know. I just wanted to put something out there for everyone who's just sitting around. Maybe they're applying to schools right now, don't know, want to see what the program's like. Here's my experience. So yeah, I hope everyone stays blessed. I hope everyone stays safe and stay indoors for now. And thank you all for watching. I'll be back with more soon.